Everybody? Oh yeah, cool. Sounds good. Seems like. How are you doing? Good. How are you doing? Good to see you. Yeah. I got to talk to you after this briefly. Look at this. I was on time and he wasn't. Good to go? Everybody good? All right. Thanks for joining us here today. First and foremost, my deepest apologies for my tardiness. I don't like being late, and I was late. Let's move on, please. My name is Aaron Lipsky. I'm the fire chief for the Milwaukee Fire Department. As you know, a large portion of what we do is responding to emergency medical service calls. Unfortunately, many of those calls are for traumatic injuries, some of those from violence, some from machinery, car accidents. Wide variety of things can happen in the big city. What we have learned in concert with the City of Milwaukee County Office of Emergency Management, Emergency Medical Services Group, is that when we look at how the military handles traumatic injuries, they have learned, unfortunately due to horrible experiences in wartime, that if you administer whole blood, you give patients a much greater chance of survival. So this is a somewhat novel idea in this area, and thank goodness that we have Doc Weston, our medical director, and Dan Pojar, who works with him closely, who have kind of ushered in a more progressive approach to some of these emergency medical services that we offer. We jumped on board with a bunch of our partners throughout the county, and what we're talking about here today is our first administration of this whole blood to a traumatic injury patient who has lived and who has survived. And this was multiple penetrating wounds from gunshot injury. This is our first time. I want to be clear that some of our partners who started just in advance of us, Wauwatosa Fire Department, the North Shore Fire Department, and South Milwaukee Fire Department have also had successful administrations of whole blood under this program. As you might imagine, this is a little different than, popping someone 2 aspirin for a headache. There's a lot of control measures in the chain of custody for handling the blood, for administering the blood, tracking all of this data. And Milwaukee County's been absolutely incredible to work with on this and many other innovative solutions to these problems. We are here at Engine 36 with Med Unit number 2 behind me. Med 2 was added just a few years ago as part of Mayor Cavalier Johnson's and the Common Council's collective coming together to get some more resources for the City of Milwaukee Fire Department to use. And this was the paramedic unit that administered that whole blood. Med 2 running out of here and Med 5 running out of Engine 13 at 30th and Locust are our 2 paramedic units that will handle and administer this whole blood. So it's a very, very solid thing for us to have. I am pleased to be joined here today by the folks of Engine 36 and Med 2, some of the hardest charging firefighters, EMTs, and paramedics you will come across. You have my admiration. Also extremely happy to have Alderman Scott Spiker, who's the chair of Public Safety and Health on the council, and the alder of this district, Alderwoman Andrea Pratt. We also have Fire and Police Commission Chair Miriam Horowitz, Chief of Staff for Mayor Cavalier Johnson, Nick Desiato is here, and then Dan Pojar and Doc Weston from Office of Emergency Management. So that was a whole bunch of information for you. I'm just proud to be a part of this program, proud to have good system partners, and I'm proud that we are we are making gains instead of taking losses. So thank you so much, and I'd like to turn it over to Doc Weston.
All right, good afternoon. Thank you, Chief Lipsky, for your leadership and dedication to advancing EMS and health here in Milwaukee. So a few days ago, as the Chief mentioned, a young man was shot multiple times here in the city, and 911 was called. And as with every time someone calls 911 in an emergency, the fire department responded to his side. Now, had that been a couple months ago, the fire department would have done what just about every fire department in the country, and certainly every fire department in the state does with somebody with major bleeding, which is provide IV fluids. Now, this is basically salt water, and these fluids, they plump up the blood vessels, which does some good, but what they don't do is the most critical job of blood, which is to carry oxygen from the lungs to the heart and to the brain to keep somebody alive. And that means they don't work very well. But instead, a few days ago, the Milwaukee Fire Department was able to provide this patient not part of blood like plasma or platelets, as you may have heard of, but whole blood, the same thing that that patient was rapidly losing. And that whole blood provided en route to the hospital can be the difference of whether a patient dies in the back of an ambulance or makes it to that hospital to receive the critical care that they need at our Level 1 Trauma Center right here in Milwaukee County. Now, this introduction of whole blood in our EMS system is a major milestone, not just for the Milwaukee Fire Department, but for our entire EMS system in Milwaukee County. And most importantly, for the patients that we serve. For over 50 years, Milwaukee County EMS has been a leader in advancing pre-hospital care. We were one of the first systems in the country to place AEDs, automated external defibrillators, in public places. And we pioneered mechanical CPR devices to take that load off of providers during a cardiac arrest. So our EMS system has never shied away from pushing the boundaries to advance care for our patients. Now, recently, Milwaukee County EMS was the first in Wisconsin, and as I mentioned, one of the first fire-based EMS systems in the country to provide whole blood transfusions in the field. Blood that now is across Milwaukee County from North Shore and Wauwatosa to South Milwaukee and here in the city of Milwaukee. And so for patients experiencing significant blood loss, every minute matters. In fact, for every 1 minute delay in receiving blood, these patients have a 2% increase in death. So by giving paramedics the ability to give whole blood at the scene, we're providing them a critical tool to save lives. Now, this time it was a gunshot wound, but the next it may be a car crash, an industrial accident, or a fall from a ladder. Any patient with major trauma can lose blood and need this critical resource. And unfortunately, trauma can happen anytime, anywhere, but the Milwaukee Fire Department and the broader Milwaukee County EMS system is better prepared now than ever before in over 50 years to save lives. And this moment is also a powerful example of what's possible when partnerships come together. This program would not have been possible without the tireless efforts of the Milwaukee Fire Department, of our team at the Milwaukee County Office of Emergency Management, the Medical College of Wisconsin, and Versity Blood Center of Wisconsin. And I also want to take a moment, certainly, to recognize our EMTs and paramedics who step up to embrace this and so many other new skill sets. As Chief mentioned, administering whole blood in the field is not simple. It requires specialized training, quick decision-making, and maybe above all, calm under pressure. But they rose to the challenge because they know what's at stake, because they believe, like all of us do, that every life is worth fighting for. So thank you to everyone who played a role in making this possible. Thank you to our paramedics and EMTs who continue to answer the call and keep our community safe. And thank you for your time. Chief?
Thank you so much, Dr. Weston. At this time, I'd open it up to any questions you might have about this.
So I was hoping to know where is the blood coming from that you guys are donated? Is it donated to you guys, or how do you guys receive that blood?
Absolutely fantastic question. I'm going to turn it back over to the Office of Emergency Management for the specifics, but it brings up a really good point that folks that donate blood are actually on the front end of saving the lives. And we need as many people to donate as possible, but if you don't mind answering that, Dan.
I think so. The question was, where does the blood come from? It comes from donors from really anywhere in the area here, but the blood's provided by the Varsity Blood Bank, and they're out by the Freighter Medical College campus, so they provide the blood to us. We have an agreement to exchange the blood product so it never goes bad or gets wasted. And then also, if we ensure that we transport those patients to the trauma center, because if they're getting blood, that's where they need to go, and then that's where they will refill their supply of blood. It's one type of blood. Currently, we carry the O positive with a low titer count, so it's a universal donor. And then at times, if there is a shortage for whatever reason of that supply, we do also have the ability to carry packed red blood cells, which is a component of the whole blood.
What about in the county? Have there been additional lives saved from this? I know this is in the city, but obviously you talk about the other departments that have it.
Sure. I'll take it. The city of South Milwaukee administered one unit of blood recently. Wauwatosa's administered blood, and then the North Shore Fire Department has administered a couple of times. So I think we've had about 7 patients all see it, and the vast majority have seen pretty significant improvement in the field.
Are there any other Milwaukee med units that have this capability, or is it just
Med 2 and Med 5.
So when a certain situation comes up, like how do they determine which men will come out, or basically how do they determine when those men are needed for those kind of situations?
You take it.
So our paramedic units are are dispatched on a closest, most appropriate response. So any advanced life support call that Med 2 is the closest paramedic unit to that call, they're going to be the ones that go. Anyone that Med 5 is the closest, they'll go. It was very important. Now we're just learning that. We're just learning how to do this here. So it was important to us because the administration of the blood has to happen pretty early after that trauma incident, that we not have this med rig driving to Cudahy or driving out by Northridge. You're losing valuable time where we could just transport them and get them going. So we're not dispatching based on a belief on the 911 call that it could be hemorrhagic or bleeding shock. So nothing has changed about how it's dispatched. We put them in this area because we do have a significant amount of trauma injury in this area.
Chief, what was the location of this patient that was shot? What was it close here?
It was in this general area. Yeah, we this is sort of a ask for your guys' discretion on this. We're intentionally vague on this specific point because we're trying to not identify a patient for privacy issues.
How much modification do you have to do with that ambulance? Adding a cooler in, or are you just always running with lights blood?
So not a whole ton. It's been a pretty easy system to absorb. We have inverters and electrical outlets in the back of these paramedic units, so it was the addition of the cooler and just making sure it was secure. It was next to no actual hard modification.
Is there additional training that people have to go through for this?
Yeah, absolutely. Our training and our certification for any of these new things comes straight from County Office of Emergency Management's EMS area, and they put a whole program together because you don't want to make mistakes on something like this, and certainly not when you know that it's an excellent program. You don't want to roll it out half baked. So yeah, all of our paramedics that will be handling this have received the training.
Are there any other med units in the city that are anticipated to get this going?
So I guess that's a question for Milwaukee County, but I would tell you if I could get it on every paramedic unit tomorrow, I would. I don't know that that's logistically possible or realistic, but it's proven itself already. Not just here, but in other systems that have used it. So anything we can do to save a life, as Doc Weston said, that's the end goal. I'd like to have them on all the paramedic units, but it's going to be a while. Good. Well, thank you so much. I really, really appreciate your coverage of this, and thanks to everybody who came here today. So thank you.